Welcome to the third episode of the series dedicated to the emotion of sadness. In this episode, we're going to talk about the effects on the emotional health of older people due to the situation caused by COVID-19, and what activities have been carried out in care homes to support them and help them manage this situation. During the investigations, it's been found that this pandemic situation is causing great harm directly to the elderly population. The pandemic has disproportionately affected the older adult population. The current demographic and epidemiological transitions require us to change the way we treat and respond to the needs of our older people. Social isolation and loneliness among the elderly has increased throughout the pandemic process, particularly in nursing homes and homes for the elderly. Older people who had not previously reported feeling socially isolated and lonely may have been disproportionately affected by the requirements of social isolation due to COVID-19 and the elimination of social contacts. In addition, older people may have been negatively affected by ageist discourses, which may seem to imply that older people's loss of life is not as important as that of other age groups. In addition, there are older people who have no friends or family and are dependent on social care, and may have felt even more isolated, especially when services are disrupted. Another population of older people who have become more socially isolated is those living in residential homes, as they were not allowed visits from friends and family for several months. This feeling of isolation and loneliness is detrimental to their well-being, as it increases the risk of anxiety, depression, cognitive dysfunction, heart disease, and mortality in older people, according to different authors referenced in the notes for this episode. There's therefore an urgent need to support older people to mitigate the negative impacts on their physical and mental health due to social isolation and ageist discourses around COVID-19. We need to support older people to enable them to have a better sense of belonging and well-being. On the positive side, throughout this pandemic, a number of senior centres and other agencies and resources have come up with different responses for the elderly. Public Health England, for example, published guidance on the 29th of March 2020 on maintaining mental health and well-being during social restrictions. Guidance for older people included the importance of staying connected and getting practical help, along with the provision of a helpline number. Other initiatives beyond the UK include, for example, a Nextdoor app, which is a platform for neighbours and communities, encouraging conversations and connections between people. From this project, Creating Wellbeing, we've conducted our own research into the socio-emotional situation of the elderly during the pandemic. We've met with workers in nursing homes and related organisations to look at the impact on the people in their care. We conducted focus groups in 5 European countries participating in this project: Romania, Spain, Ireland, Poland, and the UK. The conclusions drawn from the work with the focus groups are as follows. Close human contact with carers and family members is vitally important for the elderly as a tool to combat sadness. Adding to that, it's essential to distinguish between feelings of temporary sadness and depression, for which psychological intervention with health professionals is needed. Next, the use of telephones, video calls, and WhatsApp has been and is fundamental for the elderly to maintain contact with their families. Finally, it's essential to carry out other interventions at a socio-emotional level to improve the well-being of the elderly, since the effects of this situation are mainly related to loneliness, fear, sadness, and anxiety. With this project, we aim to encourage the development and implementation of creativity in the workers of nursing homes, contributing to improve emotional management and support for the elderly with respect to the fear, sadness, anxiety, and loneliness that this pandemic is producing. You can visit our website at creatingwellbeing.com You can go to the resources section and take a look at our toolkit of activities called Creativity Applied to Sadness, where you'll find 12 tools and activities that can be useful in coping with sadness and helping others to manage this emotion, whether as a result of the pandemic or for other reasons. Thanks for listening.